Well, more well wishes are coming in for former President Joe Biden amid his cancer diagnosis, but there are still plenty of questions as to the late stage of the diagnosis and also how it was able to get this far without detection.
Ezekiel Emanuel, an oncologist who was a Biden White House COVID advisor, now reportedly saying that Joe Biden probably had prostate cancer at the start of his presidency. Emanuel adding the prostate-specific antigen or PSA blood test used to detect prostate cancer isn't always reliable. But for that, we'll bring in Dr. David Shusterman, a medical director for Modern Urologist in New York City, also a urologist, and Dr. David Samadi. He's a leading expert in prostate cancer. Thank you both for coming on. Dr. Samadi, if I can talk to you for a bit. Going back to Dr. Emanuel and what he said, for what we know right now, by the way, the president has been diagnosed with an aggressive form of prostate cancer. It has spread to his bones. It's characterized by a Gleason score of 9. That is 1 out of 10 for viewers, and it's at a level 9. So when Dr. Emanuel spoke about this, and other oncologists as well, they're very much in lockstep, saying there's no way this developed in the past 100, 200 days. This looks like this could have been here past 5 years, maybe even up to 10 years. Is it possible, Dr. Samadi, that these doctors at Walter Reed or the president's physicians, they just completely missed it all 4 years of his term? Or would this have been omitted? Where does your mind go on this?
Well, I think it's very difficult to imagine that someone at the caliber of President Biden, having gone through so many years of screening, that this is something that they could have missed. Anything is possible, but Gleason 9 is a very aggressive prostate cancer. It takes many years to develop. And we don't see, almost like 10% of prostate cancers that come, they come at this late stage with metastases. And fortunately, we don't see a lot of that in America because of our screening process. Now, when you go to other countries in Middle East, etc., they may present themselves with high PSAs, 50s to 100, and late stage as an example like this. But in this country, it's very rare to see something like this, especially the fact that his doctors mentioned in 2024 that he has clean bill of health. I'm sure they have checked his PSA. It's funny, one of the anchors were talking about not getting PSA checked after 70 because it's expensive. That doesn't work in this country. A lot of men are asking for this because they're also living to their 80s and 90s. It's a simple blood test, and that's 85% of prostate cancers are detected through this blood test, and the 15% is detected through prostate exam, and which is where they found the nodule. A nodule is a firmness in the prostate, takes years sometimes to develop, and it's an aggregate of cells that are about to leave prostate or metastasize. So it's a very unfortunate situation, and the question is, how many years President Biden has had this cancer? When was it detected? There are more questions than answers, unfortunately.
Right. And then when was it publicly shared, right? We're going based off what we know, and that just only recently came out. Dr. Shusterman, if I could ask you, knowing what is publicly available right now, what does his treatment options look like? And really, what's in store for the former president?
Well, just to go back to the Dr. Samadi's point about the PSA testing, I mean, there's no such thing as PSA is expensive. Actually, the PSA test is relatively inexpensive. It's under $20, so we could afford that for the president, I bet. But that's not even the point. The point was that we don't have the results, actually. And so we're assuming they're negative, but, we have the results for the last 4 presidents, all males, and they were all normal and they were publicly released. And yet, in the 30 years that Joe Biden has been doing PSAs, not a single value has been released, which is, quite surprising. In addition, we don't have any of his other labs like testosterone and other things that I would like to know in this case. But the point about diagnosing, I mean, this is any urologist would be able to diagnose prostate cancer at an early stage, and this happens very rarely. I tell people that this is more of a VA situation where someone hasn't sought medical care for 10 years, and they come in to see a doctor, and then they find that they have advanced stage prostate cancer. So it's quite shocking that Joe Biden has this cancer without the top doctors in America knowing about it.
Yeah. Dr. David Samadi, President Trump reportedly suggesting that the former president, President Biden, delaying sharing his cancer diagnosis, telling reporters that President Biden's doctors should have caught this cancer earlier. Trump suggesting the doctors who gave Biden a clean bill of cognitive health missed early signs of his cancer. The president went on to say, quote, "I'm surprised that the public wasn't notified a long time ago to get to stage 9. And that's a long time. I think that if you take a look, it's the same doctor that said that Joe was cognitively fine. There was nothing wrong with him. If it's the same doctor, he said there was nothing wrong there, and that's being proven to be a sad situation," quote. And staying out of the political fray for both of you here, but Dr. Samadi, just out of respect for the office itself, how important is it for the commander-in-chief to be transparent about what they're facing medically?
Well, I think he's in a very important position. The whole country depends on him. And let me just say also, like, there's a lot of sympathy and we wish him well, because this is a very difficult cancer. And I think it's very clear for them to be forthcoming, because when this cancer is caught early on with a lot of our robotic technology and radiation, we're able to take care of patients like this. Now, Gleason 9 happens to be quite aggressive. So if I would have seen him in the office at early stage while the cancer is contained in the prostate, with robotic surgery and possibility of radiation after that, he had a very good chance of cure long term. Unfortunately, you asked about the treatment options. At this point, hormonal treatment, reducing the level of testosterone, which has a lot of complications and side effects for him, is something that's going to be treated. What's the survival? Probably 5 years plus. Of course, across the board, it's different. Different patients react differently. As long as he's reacting and is sensitive to the hormone, he will do well. But the day that becomes insensitive, chemotherapies are not very effective, and unfortunately, the prognosis is not so good. So we wish him well, but I think it's important to put the politics aside.
Sure.
and just take care of his health, and that's really important.
Well, just think, if this would have been either diagnosed earlier or shared publicly earlier, you can remind men to get screened. I mean, he was leading the Cancer Moonshot Initiative. What an opportunity there. I know there was going back in time, a little soundbite in which he claimed to say, "I did have cancer," but there was a lot going on. We weren't sure exactly what he meant by that at the time. Dr. David Shusterman, Dr. David Samadi, appreciate you both coming on. Thank you so much for your time.
Thank you for having us.
Thank you.